Hello, guys. Good evening, every nursing student, guys. Good evening. This is Dr. Louine, once again for another short video tonight, as I promised you guys. But before I continue with this video, I'm asking every single one of you, if you are LPN, if you are RN student, encourage what I'm doing by doing what? Just go to my YouTube channel. I do it in English for everybody. So now, go to my YouTube channel, guys. Subscribe. This is the only way you can help me. You can help me continue with this work. Now, if you want me to continue, and I'm doing it for you guys. If you want me to have more and more videos every week for you, go ahead and click on the bell button, subscribe. I need more and more subscribers so I can continue with these videos, guys. Now, tonight, Dr. Louine gonna talk about one topic, one fact that is very important for your Nclex exam. This is an Nclex tip facts, so there's no doubt on it. Remember, if you need a full review, I'm doing short videos. I'm showing the whole nation. I'm showing every student everywhere where you at, guys. I'm teaching. I'm showing you with my short videos how do I teach, and I do teach in all languages. Now, if you want a full review, call Dr. Louine. This is Dr. Louine. Call me at 561-319-4660. Now, if you need a full review, you want to pass NCLEX like every student. If you want to pass NCLEX with no struggles, with no depression, with no doubt, call me now at 561-319-4660. Subscribe, like the page, guys. Put your comment in there. So now, tonight, I'm going to talk about digoxin. Digoxin is one of the top medications in Nclex. I decided to speak a little bit tonight, a short video, to teach you the Nclex tip question for digoxin. Now, what should you know about digoxin? That's the key one. Now, what is digoxin? First of all, the very first thing, if you're going to talk about, if we go to Nclex and you want to answer this question, the very first thing you got to know, you need to know what is this medication. What is digoxin? That's the first question I'm going to ask you tonight. Make sure you know it. Make sure you answer this question. Now, what is digoxin? That's the first question. Take your pen. You know it. You know already, guys. Take your pen, take your paper. We're going to talk about digoxin tonight. Now, if you want to encourage me with this job to update everything, to have a page, because I need a page where while I'm talking, guys, I want to make sure I show you like everybody else, encourage what I'm doing, guys. If you're encouraging other people, guys, who are doing things that are not important for you, for your career. So how much more if I'm encouraging you tonight? Encourage me by doing anything. I need the platform. I need a website. I need something. What I'm talking, I can show you, the cardiac. I need to show you what I'm teaching, but I don't have it yet. And I need somebody to help me do that, to create a website, create a platform for me. So what I'm teaching, you can see, if I'm talking about cardiac, you can see the heart pumping. I need to do it like other people, guys. So that's the thing. Not only you subscribe, encourage me this way so I can put everything better and better for you guys. Now, what should you know about digoxin in your exam? Remember, digoxin is a cardiac medication. That's the very first thing you got to know. Digoxin is a cardiac medication. Now, as a cardiac medications, they give this medication where? That's the key point. Not only they use it as a cardiac medication, patient with asthma problem, underline this one. With asthma problem, they give them digoxin also to regularize the cardiac issue, to make sure your heart rate become regular. Now, when patient has cardiac disease, digoxin has a positive effect on your heart, which they can call them positive inotropic, positive chronotropic, or positive dromotropic. That's digoxin. Now, digoxin is a very important medication. At the same time, they consider as in one of the potent electrolyte, because there is a normal range you need to know for digoxin, because digoxin can be very toxic. And if you don't know digoxin, you know nothing. That's why I say take your note and pay attention. Now, what is the normal range for this medication? The normal range for Nclex is 0.5 to 2.0. Now, if it's 0.5 to 2.0, which is the normal range, that's okay, I can give it. But whenever you see, that's an Nclex tip question, whenever they say digoxin lab is 2.5, is 3.3, 3.0 is high. When the lab is high, that's a toxicity. Now, patient gonna start presenting signs and symptoms of the digoxin toxicity. Pay attention to those signs and then select all that apply. What are those signs and symptoms should you expect if patient has a lab value of 3.0, 3.5? That's very high. Now, the next thing you need to know before even you go on those signs, or before even you go to those signs and symptoms, let's talk about a little bit about digoxin. What should you do as a nurse? They're gonna tell you what is your nursing action, or what should you teach the client. Let me tell you that. As a nurse, what should you do when you give digoxin? Make sure, that's the Nclex tip questions. Make sure if you're giving digoxin to always assess the apical pulse, and the heart rate of your patient. Do that before you give it. LPN, RN, pay attention. Now, the key point, the key Nclex tip, you never give digoxin if the apical pulse is less than 60. You cannot give it. Don't do that. That's the Nclex tip question. Number two, if you give digoxin or digoxin to a patient, you need to monitor a very important electrolyte. What is the name of this electrolyte? Take note. Potassium. The king potassium. Now, how's potassium gonna be? Pay attention. That's another tip. Potassium gonna be low. Hypokalemia. Now, if you give him digoxin, that's another Nclex tip question. Monitor always the lab value for potassium. Now, if patient or the nurse give you a report and the potassium is 2.0, potassium is 1.5, that's low. Now, if potassium is low, don't give digoxin. You better call the doctor. You cannot give it. Pay attention. Now, what do you know about toxic? What happens is whenever you give digoxin, you need to pay attention. You need to monitor calcium channel blocker, the medication of calcium channel blocker, because that can increase the digoxin level also. What? Don't give them at the same time. Pay attention in Nclex. This is a lot of Nclex tip thing I tell you guys to watch in your exam. Now, the next Nclex tip questions: what are the signs and symptoms of digoxin toxicity? That's very important one. Now, Nclex student, I tell all my students the same thing. How do you know them? There's two categories. There's one called early signs. Pay attention with the question. There's early signs of toxicity, and there is late sign of toxicity. Dr. Louine, please give me some example of early, give me some example of late. Now, when the patient has digoxin toxicity, the patient gonna have early sign, and let me give you 5 minimum. The early sign has to do with gastrointestinal, that's a tactic right there, gastrointestinal disturbances like nausea, vomiting, diarrhea. Now, if I have nausea, vomiting, and diarrhea, that can drive me to all the other signs and symptoms that are considered early signs. What? That makes sense. If I am dehydrated, if I have vomiting, I'm gonna be dehydrated. Makes sense? Dehydrated. Now, if I am dehydrated, I'm gonna be thirsty. I'm gonna have dry mouth or dry mucous membrane. Nclex tip question or this. I'm gonna have dry skin. Those are the signs and symptoms of digoxin toxicity, early signs. Now, I can go further and further, one and one, and tell you more signs you don't need to memorize. With Dr. Louine, you have no need to memorize those signs. And one of the things that happen to students, they don't have no tactic. They're trying to get everything together, and they're trying to memorize everything. And when you try to know everything, you know nothing. Now, if I am dehydrated, my heart gonna be trying to compensate. That's another sign that's gonna make me remember. Now, tachycardia is the early sign. See, I'm thirsty, I got it. You don't need to memorize it. Pay attention. You're gonna pee a lot. Now, late sign. Let me give you minimum 5 symptoms. For late sign of toxicity, that's your priority. Let me say it again. That's your priority right now. If patient is presenting late signs of digoxin toxicity, let me give you sign and symptom of late toxicity. Now, confusion is one. When you confuse, tremor, seizures, when you agitated, have no control on you, irritation. I don't need to memorize them, because vision problem is one of the top signs you need to pay attention to, because the patient gonna be going to restaurant. The patient used to read his menu, and then now for some reason he's on digoxin and he has to take his glasses to read it. Oh my God! You cannot read. You have vision problem, and the vision problem in Nclex is arrow vision or yellow, greenish vision. In conclusion is blurry vision. That's why the patient didn't need before to use glasses. Now, the fact that the patient is on digoxin, Nclex tip question. The patient is using his glasses to read the menu. Vision, that's my concern. Nclex tip question. Now, that's a late sign. Hypertension problem, bradycardia problem. Now, patient may have shakiness, tremor, like I said. So if patient is having all those signs, patient report to the nurse all those signs and symptoms while he or she is on digoxin. That's a priority question. Remember them for Nclex. This is how I teach my students, guys. So excited, tell them the tactic to remember them. You know what? All those signs and symptoms I say as late has to do with the patient brain. Most of them. That's how you need to remember it, or remember all of them for Nclex exam. Now, if you don't have no tactic and strategies, you're gonna be in big trouble in Nclex, because there's a lot of content to know, there's a lot of fact to know. But with Dr. Louine, I know the secret of Nclex. There's no game. If you want to learn more, if you want to learn in your own language, guys, do not wait. Don't let anybody out there fool you. I speak Creole, the Haitian. I say that in all my videos. Guys, if I'm doing that, it's just to encourage you. What should you do if you need a full review? What I'm doing just a very quick fact in 15, sometimes 10 minutes. Now, I don't give you all thing, I give you just little thing. If you need a full thing, a full review, call me at 561-319-4660. Now, remember that patient have late sign, call the doctor. Stop the medication. Toxicity, stop the medication, call the doctor. You assess the client, you stop first, you assess and call the doctor. Remember that. You never call the doctor until you do something. Guys, the other thing I'm going to tell you to finish with this little video, we should remember the other name of digoxin. Lanoxin and then digitalis. Lanoxin and then digitalis. Now, when it's toxic in Nclex, as your Nclex tip question, what do you give? What should you give? What medication should you expect the doctor to order? Nclex tip. Ben. I don't know what Ben is that. I don't know if the Ben too dense. I don't know. But for Nclex, whenever the patient is taking too much digoxin or the patient is toxic, guys, get ready your DigiBen medication. Dr. Louine, #1 instructor for your Nclex exam. #1. Not only I am a doctor, I have my license in nursing, and I took the exam. I know the secret of it. Thank you for watching this video. Thank you again, guys. The only way to support what I'm doing is to subscribe. Click on the bell button. When I have a new video, you can be aware of it. Thank you again. And the number to call is 561-319-4660. I speak different languages and I have reviews in different languages. See you guys for another short video. Thank you for watching. Thank you for supporting what I'm doing. Subscribe. Thank you guys. See you next time.